The effect of epinephrine on arterioles at lower concentration is going to be vasodilation, because it's only binding beta-2 receptors, whereas at higher concentrations, we can bind both. So we're going to have both vasoconstrictions on all other tissues except skeletal muscle, cardiac muscle, and the brain is sort of exempt from this. And then on skeletal and cardiac muscle, we have vasodilation, which is brought about by the binding of epinephrine here. And again, this is when we flood the system with epinephrine. Think about exercise, think about the fight or flight response. And the reason that we do this, the reason that we vasoconstrict most of our vascular beds and vasodilate vascular beds to skeletal and cardiac muscle is to not only shunt blood to those tissues that need it, but also to maintain TPR, to increase and maintain TPR, which is increasing and maintaining blood pressure. So think about a scenario. If you are shunting most of your blood to heart and muscle, isn't there a propensity to decrease blood pressure? There is, and we don't want that. So we need the other tissue beds, the other vascular beds, to vasoconstrict to help keep that TPR up, to help keep that blood pressure up. Okay, and then these are the hormones that we spoke about a while ago. So these are the last mechanisms of intrinsic control. Epinephrine, we know, has that dual ability. It can be a signaling molecule, a neurotransmitter. It can also be a hormone if it's released from the adrenal. Vasopressin, or ADH, is a hormone secreted from the posterior pituitary, and that is going to increase water reabsorption in the distal parts of the kidneys. And then we have angiotensin II. Both of these are also going to increase our TPR. Both of these are going to vasoconstrict our blood vessels or raise or maintain our blood pressure, okay? We typically give these to hemorrhaging patients or patients who have otherwise lost blood volume, or if you're dehydrated, your body secretes these on its own. And these are ways to keep the blood pressure up via vasoconstriction.